We turn now to Rebound Kansas City, and we want to help you manage the pressure of this difficult and unusual time. So many of us gave up family gatherings, rituals, or other memory-making moments to keep ourselves and others safe from coronavirus. We know it was a very difficult decision. Now, local psychologists say they're seeing a lot of depression, a lot of anxiety, and hopelessness amongst patients. Our reporter Emma James tells us what you can do to help ease this mental strain.
Between the pandemic, not seeing family for the holidays, and transitioning into colder months, many Americans are feeling the mental strain right now, including frontline workers here at Truman Medical Center like Raquel Garcia.
Have to put on the bunny suit, as I call it, double mask, goggles, shield, everything.
Raquel is part of a team of people doing mobile testing sites all over the metro. Along with the difficult job of working on the front lines, COVID is taking an emotional toll in her personal life. She's lost close friends and family members to the virus.
It's just one funeral after another. It's getting to the point where you're almost immune to, it's hard to be sad anymore. You're building a wall.
Raquel says the vaccine gives her a new sense of hope. She hopes it does for others too.
The end is coming. Normalcy is coming.
But she doesn't sugarcoat it. We've got a lot of work to do to get there.
So making sure that we take responsibility for that we know that it's not going to come back unless we all participate in this and understand what herd immunity is.
Clinical psychologist Abby Gripka says the root of much of the depression she sees is from isolation. There are some things to do to help.
Still trying to stay physically active or still trying to just step outside, get a change of pace, go for a drive, get out of those four walls.
She says it's normal to feel some hopelessness or anxiety right now, but you should seek help if you're not able to get out of bed, lose your appetite, or are thinking about ending your life. We have resources for anyone struggling on our website, kshb.com. In Kansas City, Emma James, 41 Action News.
You know, if you or someone you know is in need, please refer them to that website with all of those resources. Crisis hotlines continue to see record levels of calls from people who need the help. The crisis text line reported its highest ever number of monthly conversations in November with more than 180,000. 90% of those conversations were from people 34 years old and younger. Other hotlines such as Youth Line and the Trevor Project reported an increase of 35 to 50% in calls just this year.